stomach channel of the foot Yang-Ming. The Ling Shu Jing Mai states, the stomach channel of the foot Yang-Ming originates at the lateral side of the nose. So right away, we know that points on the stomach channel will affect the nose. It ascends to the inner canthus at the level of the root of the nose, where it meets with the bladder channel, foot Taiyin. Turning downward along the lateral side of the nose, it enters the upper gum. Bleeding gums is a sign of stomach heat due to this relationship, or at least is associated due to this relationship. Emerging, it curves around the lips and descends to meet with the Ren vessel at the mentolabial groove. It then runs posterior-laterally across the lower portion of the cheek to stomach 5. Winding along the angle of the mandible, it descends to the front of the ear and traverses gallbladder 3 and follows the anterior hairline and reaches the forehead. The facial branch emerging in front of stomach 5 turns downward to stomach 9. From there it runs along the throat and enters the supraclavicular fossa. Descending, it passes through the diaphragm, enters the stomach, and connects with the spleen. A straight portion of the channel arising from the supraclavicular fossa runs downward, passing through the nipple. It descends alongside the umbilicus and enters stomach 30 at the inguinal region. A branch from the pyloric sphincter of the stomach descends inside the abdomen and meets with the previous portion of the channel at stomach 30. Traveling downward, it goes through stomach 31, further going down along the lateral margin through the thigh. It reaches the knee. From there it continues downward along the anterior border of the lateral aspect of the tibia, passes through the dorsum of the foot, and reaches the lateral side of the tip of the second toe. The tibial branch emerges from stomach 36, 3 cun below the knee, and ends along the lateral side of the middle toe. A branch from the dorsum of the foot arises from stomach 42 and terminates along the medial side of the tip of the great toe. It connects with the stomach, spleen, large intestine, small intestine, and diaphragm. It connects with the nose, eye, mouth, upper teeth, and breast. Remember, large intestine connected with the lower teeth, stomach to the upper teeth. According to the mysterious pivot, the Ling Shu Jing Mai, the diseases that stem from the stomach channel of the foot Yang-Ming include chills, yawning and stretching oneself often, black color of the forehead, aversion to people and fire when becoming ill, fearing the sound of wood, palpitations, and preferring to stay alone with the doors and windows closed. When the disease is severe, the patient may sing loudly in a high place and run about without clothes. He has abdominal distension and borborygmus. These are due to the adverse flow of qi of the tibia. Diseases of the stomach channel of foot Yang-Ming relate to blood and manifest as mania, malaria, febrile disease, sweating, profuse nasal discharge, nosebleed, deviation of the mouth, lip, sores, swelling of the neck, sore throat, ascites, swelling and pain in the kneecap, pain along the chest, breast, inguinal region, and anterior side of the thigh. Stomach 32 at the lateral side of the tibia and the dorsum of the foot, and middle toe cannot move. When the foot Yang-Ming channel is in excess, the patient will have hot sensation in the front part of the body, swift digestion, rapid hunger, and yellow urine. When deficient, the front of the body will be cold, There will be cold in the stomach, causing distension and fullness. And the stomach channel has a lot of indications. Tremendous amount. The channel itself traverses many areas of the body. What we're looking at here is a combination of the gut-brain axis. And this explains why there are so many different indications. And particularly the homunculus within the brain, if you look at the indications of this channel, it matches up quite closely. So let's look at this again. Diseases that stem from the stomach channel of foot Yangming are chills. Why chills in this case? Well, if deficient, people feel cold. The Yangming has all of the qi and blood, not literally all, but the most qi and blood. If it's deficient, the stomach isn't working, people aren't able to make nutritive qi, not to be able to make zong qi, chest qi, no ability to make wei qi, then this kind of chills are what you would expect. Yawning and stretching oneself often. Why yawning? Yawning is a sign of kidney deficiency. In this case, the post-heaven qi from the stomach is not nourishing. As a result, there's tiredness. Stretching oneself often, it's actually stretching and yawning are part of the same action, and they're used to tonify the body. If you breathe in and hold it and stretch, this is a way that we naturally tonify. So seeing somebody, especially trying to stretch the limbs respond, or they correspond to the earth, to the spleen and stomach. So as they're trying to do this and yawn, it's a sign that they're trying to fill the body with qi. And it should be filled due to the Yangming. Black color of the forehead. In this case, the stomach channel goes to the forehead. Earth is controlling water. If the earth is not there, the qi of the earth is not there, then as a result of that, becomes water accumulation, which will appear black. Black being the color of water. In this case, it's just not controlling. Aversion to people and fire when becoming ill. So aversion to people, like if you're sick and run down, your immune system's run down, you don't want to be around other people because they have diseases you don't want to catch. Aversion to fire in this case is more to do with excess in the stomach channel. Afraid of hearing sounds made by wood. In this case, they're not specifying it, but this would be a case of deficiency. And because the stomach belongs to earth is deficient, then wood would overact. And it's not just the sound of wood, but anything relating to wood is not going to be comfortable, because it will be over-controlling something that is already deficient. Preferring to stay indoors with the windows closed, again, this is a sign of deficiency. When the disease is severe, so in this case severe, they're talking about fire in the stomach or dampness in the stomach and spleen, which is causing phlegm and fire to rise up, which will cause people to sing loudly in a high place and run about without clothes. Why without clothes? Because they feel hot. Why are they ascending to a high place? Again, they're trying to use that upward energy. They're trying to go with that upward energy. Saw this happen literally. A man who was on drugs in Victoria, BC, was up on a roof without clothes, singing, and it was in the rain. I thought, well, there is the stomach channel awry. There's some excess in the stomach channel there. So the stomach channel, especially stomach 40, is used to eliminate phlegm. And this phlegm, there are a lot of points that are useful for mania and phlegm on the stomach channel. And this has to do with the gut-brain axis. Abdominal distension and borborygmus in this case are due to cold in the stomach channel. So they say adverse flow of qi, it's supposed to go down. It's not. Generally, in this case, it's due to this coldness. Now, why didn't the authors specify, well, this is due to coldness, this is due to this? Why didn't they specify the way that I am now? Because the audience for this was already that was their only frame of reference, was this kind of Chinese medical reference. So these kind of expressions in the Ling Shu are basically something you would memorize and be like, oh yeah, those are all possibilities. But looking deeper at where the channel goes, and then looking at the patterns, the trajectory of the channels, a lot of this becomes pretty apparent, which is why I'm going over it twice. Diseases of the stomach channel relate to the blood. Now, yes, it makes blood, but let's also look at how many of those branches come off of stomach 30, which is a point very important for the Chong. And if you get a massage and you have people, there's a technique people do in China, and Sichuan in particular, where they will seal off the femoral artery at stomach 30, and then they release it, and you feel this rush of blood come up through the chest. It is great, and it's kind of like pinching off the hose to increase pressure. But you can feel it actually go up through your digestive organs. And if your stomach is sluggish at all, then that can really move blood through the digestive organs. And so this is why it is used as well for gynecological purposes. It also says, again, mania and malaria, febrile diseases, sweating, profuse nasal discharge. Remember the nasal discharge, if you look at the trajectory of the channel, it kind of starts up by the nose. Nosebleed, deviation of the mouth. Again, this is channel trajectory. Sore throat, ascites. Swelling and pain of the kneecap. Again, channel. Pain in the chest, breast, inguinal region. Channel, channel, channel. It says when the foot Yangming channel is overabundant, the patient will have a hot sensation in the upper part of the body. Swift digestion with rapid hungering. Yellow urine. Why yellow urine? There's heat. It's very easy for the stomach channel, which the stomach likes wet. The spleen likes dry. If the stomach gets too hot and dry, then you get yellow urine. You get this kind of upward motion of fire. And when deficient, the front of the body will be cold. And cold stomach, in this case, would be an excess condition, causes distension and fullness. So points of the face, stomach 1 through 8. Stomach 1, Cheng Qi, on the face directly below the pupil, between the eyeball and infraorbital ridge. This is good for eye stuff. Needle perpendicularly and slowly 0.3 to 0.7 sun along the infraorbital ridge. Don't get too lifty and thrusty here. You'll blind them like Polyphemus. And don't use mox on the eye. Some people do anyway, but yeah, I never have. Stomach 2. 四白, on the face, directly below the pupil, in the depression of the infraorbital foramen. Good for local diseases, twitching of the eyelids. Needle perpendicularly, 0.2 to 0.3 cun. Stomach 3, 猪寮, on the face, directly below the pupil, at the level of the lower border of the alanasi, beside the nasolabial groove. Good for local stuff, twitching of the eyelids if you've got wind, toothache, nosebleed. And why those indications? Remember where the channel goes. It's in that neck of the woods. It's going to have those neck of the wood kind of indications. 0.3 to 0.6 cun. Stomach 4, 地仓, on the face, directly below the pupil, beside the corner of the mouth. This is good for, deviation of the mouth, salivation, toothache, swollen cheek, twitching of the eyelids. 0.2 cun, or transversely 0.5 to 0.8 cun. You can even thread to stomach 6 if you are so inclined. Stomach 5, Taiyin, anterior to the mandibular angle on the anterior border of the masseteric attachment, where the pulsation of the facial artery is palpable. This is good for facial deviation, clenched jaw, facial pain. Needle transversely 0.2 to 0.3 cun, or transversely with the tip of the needle directed towards stomach 6, where it's nice and meaty on the jaw. Moxibustion is applicable. Stomach 6, jiachi, on the cheek, 1 finger breadth anterior and superior to the mandibular angle in the depression where the masseter is prominent. This is good for deviation of the mouth and eye, toothache, swollen cheek, swollen face, mumps. It's a very useful point. I like it. Perpendicular 0.3 to 0.4 cun. Obliquely in the direction of stomach 4, 0.5 to 0.7 cun. Stomach 7, 下关, on the face, anterior to the ear in the depression below the zygomatic arch at the mandibular notch. This is amazing for TMJ. Really great. Facial pain, ear diseases, often combined with Sanjiao 17 for toothache and those kind of problems. Very good for tooth and jaw stuff. Stomach 8, 头围, on the lateral side of the head, 0.5 cun above the anterior hairline at the corner of the forehead, and 4.5 cun lateral to the midline of the head. This is good for headache, eye diseases, wind. But basically, stomach channel is being weird or fiery and it sends chi up. That's where you're going to vent it. Or wind is coming from the outside in. That's when you're going to vent it. If you've got a headache, you can combine it with gallbladder 20, large intestine 4. Why? Wind. If it's due to fire coming upward, stomach 44. Pretty easy. Needle downwards or backwards, 0.5 to 0.8 cun, transversely. Don't do moxa here, because again, this is where fire is kind of boiling up. You really want to vent this off at this point. Points of the neck, stomach 9 to stomach 12. Good for diseases of the throat and local diseases. Stomach 9, 人迎, on the neck, beside the laryngeal protuberance, and on the anterior border of the sternocleidomastoid muscle, where the pulsation of the common carotid is palpable. Good for its, chi boosting and goiter, scrofula, difficulty swallowing. Avoid the common artery. Needle perpendicularly 0.2 to 0.4 cun. Stomach 10. 水突, on the neck, on the interior border of the SCM, at the midpoint of the line connecting stomach 9 and stomach 11. Good for sore throat, asthma, cough. Perpendicular 0.3 to 0.4 cun. Stomach 11. 气实, upper border of the medial end of the clavicle, between the sternal and clavicular heads of the SCM. Good for local stuff, pain in the neck, asthma, hiccup, goiter. Needle perpendicularly 0.3 to 0.4 cun. Stomach 12. 椎盘, at the center of the supraclavicular fossa, 0.4 cun lateral to the midline. Now remember with the stomach channel how much was going in and out of the supraclavicular fossa. This is one of these points that in the book it doesn't seem to be that important, but if you look at the channel trajectory and how much action is in this area, it actually is a fairly important point. Points of the chest, stomach 13 to 18. 13. Qi Hu. On the chest, below the midpoint at the lower border of the clavicle, 4 cun lateral to the anterior midline. This is good for distension of the chest, cough, hypochondriac pain. Needle perpendicularly, 0.2 to 0.4 cun. Stomach 14. Ku Fang. On the chest, first intercostal space, 4 cun lateral to the anterior midline. Chest stuff, 0.5 to 0.8 cun. Stomach 15. Wu Yi. On the chest, on the second intercostal space, 4 cun lateral to the midline. Chest stuff. Mastitis, because we're getting into the chest stuff region. Needle perpendicularly, 0.2 to 0.4 cun. Stomach 16. Yin Chuang. On the chest in the third intercostal space, 4 cun lateral to the anterior midline. This is good for chest stuff and mastitis because we're getting to the titty region, and the nipular region is next. But stomach 16, 0.5 to 0.8 cun. Stomach 17. This one we don't needle. We attach babies to it. Not all the time, and generally when they're your own. Stomach 17, Ru Zong, which means middle of the nipple, and that's where it is. Fourth intercostal space at the center of the nipple, 4 cun lateral to the anterior midline. Now, I was watching Golden Girls one time, and this man was kissing one of the Golden Girls, and he had his hand about on her waist, and another one of the Golden Girls said, if he puts his hand any lower, it will touch her breast. And that's funny because it's an old lady joke. But it does beg the question, is this the middle of the nipple, or is this the middle of where the nipple was before bodies start changing around puberty? Yeah, that's actually a tough one and an area of some debate. But generally speaking, yeah, people will say 4 cun lateral to the anterior midline anyway, because skin can go all over the place. But do the nerve endings care? I don't know. In any case, you're not going to be needling this or doing moxa. So it's more of an anatomical marker. But it is important to remember because when we're dealing with lack of milk production, we're going to be using the stomach channel and using the Yang Ming. So it is very important for nursing mothers in particular. Stomach 18, Ru Gan. This is the root of the breast. That's the literal name of the point. On the chest, directly below the nipple, on the lower border of the breast, in the fifth intercostal space, 4 cun lateral to the anterior midline. Chest stuff. Insufficient lactation. So, while we don't needle stomach 17 for insufficient lactation, we will use stomach 18. Points of the upper abdomen, stomach 19 through 24. And then 25 is where we get to the belly button region. That's another anatomical marker, so we're going to remember that. Comes to the stomach channel. We've got these it's a long channel, so I like to think of it in breaks. Like you've got the eye area, the jaw area, neck area, chest and breast area, and now we've got the upper stomach area. Stomach 19 through 24, good for stomach stuff and cray-cray. Gut-brain axis. Stomach 19, Purong, on the upper abdomen, 6 cun above the center of the umbilicus, 2 cun lateral to the anterior midline. 6 up, 2 across. 6 up from the belly button, 2 across, stomach 19. Poor appetite, abdominal distension. Perpendicular insertion, 0.5 to 0.8 cun. Stomach 20, Chengman, on the upper abdomen, 5 cun up, 2 cun out. 2 cun lateral to the anterior midline. Stomach ache, poor appetite. Perpendicular, 0.5 to 0.8 cun. Liangman, on the upper abdomen, 4 cun up, 2 cun lateral. Diarrhea. Stomach 22, 关门. On the upper abdomen, 3 tun up, 2 tun lateral. Border ligaments, diarrhea, edema. So we're getting into the watery area. And that's important because when water is out of control, bugs that make cray-cray start to proliferate through dampness, phlegm, fire. Stomach 23, Taiyin. So this one's named after a star. I think that's Venus. On the upper abdomen, 2 tun above the center of the umbilicus, 2 tun lateral to the anterior midline. Manic depressive psychosis and indigestion, restlessness. Stomach 24, 或肉门. On the upper abdomen, 1 tun above the center of the umbilicus, 2 tun lateral to the anterior midline. Stomachache, vomiting, manic depressive psychosis. Needle perpendicular, 0.5 to 1.2 tun. This also has to do with bulimia. Good for eating disorders as well. Stomach 25 through 30. In this area, of course, stomach 25 is kind of like anything going weird with your guts. It will help it. But we're getting into gynecological area. And this is very, very useful, especially for nourishment. Remember, the stomach channel has the most qi in blood. It is going to be helping to create blood. So this is a very, very great nourishing area. Stomach 25, 天枢, the front moo point of the large intestine. You got diarrhea? Fixed. You got constipation? Fixed. You do this just right and you get nice. All things gut stuff and mental diseases due to gut stuff and lady problems due to gut stuff. Also headache. Very versatile point, one of my favorites. Needle perpendicular, 0.8 to 1.2 tsun. Moxa is very welcome. It's lateral to Ren 8, so you can also just stuff the belly button with salt or ginger and have a moxa party. Stomach 26, Wailing. On the lower border, 1 tsun below the center of the umbilicus, 2 tsun lateral. Hernia, dysmenorrhea. 0.8 to 1.2 tsun. Moxa is welcome, warmly welcome. Stomach 27, 大致. On the lower abdomen, 2 tsun down, 2 tsun out. Distension and fullness of the lower abdomen. Hernia, premature ejaculation, or seminal emission. Needle perpendicularly, 0.8 to 1.2 tsun. Moxa is warmly welcome. Shui dao, water pathway. Important one, stomach 28. On the lower abdomen, 3 tsun down, 2 tsun out. 2 tsun lateral. Retention of urine, edema, hernia, dysmenorrhea. So it says infertility, but why? This has to do with flooding in the body. Stomach 29. Gui lai. On the lower abdomen, 4 tsun lateral to the center of the umbilicus. 4 tsun down, 2 tsun lateral. 4 tsun down, 2 tsun lateral. Stomach 29, Gui lai. Dysmenorrhea, hernia, menstrual stuff, amenorrhea, leukorrhea of the morbid variety, prolapse uterus. 0.8 to 1.2 tsun. Moxa is very warmly welcome. Stomach 30, Qi Chong. Why the Chong in this? It relates to the Chong Mai Chong. Center of the inguinal groove, 5 tsun below the center of the umbilicus and 2 tsun lateral to the abdominal anterior midline. Bergamus, external genitalia pain, impetus, dysmenorrhea. Really important point. Look at the channel trajectory. You're going to see this is where the stomach channel diverges in many different areas. Points of the thigh, 31 to 34. Indicated for leg stuff. Weird. Stomach 31. 闭关. On the anterior side of the thigh, on the line connecting the anterior superior iliac spine and the superior lateral corner of the patella, on the level of the perineum when the thigh is flexed, in the depression lateral to the sartorius muscle. Thigh pain, muscular atrophy, needle perpendicularly 0.6 to 1.2 cun. Fu Tu, stomach 32. On the anterior side of the thigh, on the line connecting the ASIS and the superior lateral corner of the patella, 6 cun above this corner. Pain in the lumbar and hip, coldness of the knee. Beriberi. 0.6 to 1.2 cun. Stomach 33. Yin Shi. Yin market. On the anterior side of the thigh, on a line connecting the ASIS and the superior lateral corner of the patella, 3 cun above this corner. Aching pain of the knee. Motor impairment of the motor limbs. 0.5 to 1 cun. Stomach 34. Liang Qiu. The Shi cleft point. So this is good for acute stomach and spleen problems, as well as for pain along the channel, difficulty in extending the knee, etc. Needle perpendicularly 0.5 to 8 cun. Moxa warmly welcome. Points of the leg. Yeah, now we're getting somewhere. Stomach 35 to 40. This is where we've got some high potency points. Stomach 35. Du Bi. When the knee is flexed on the knee in the depression lateral to the patella and its ligament. Good for knee pain. Needle on both sides to get that disc in place. If you want to do the cow nose special. 0.5 to 1.2 cun, slightly toward the anterior and patellar ligament. Moxa is applicable. Stomach 36. Oh. Our angelic stomach 36. Our He Si point and lower He Si of the stomach. Zu San Li. On the interior lateral side of the leg, 3 cun below stomach 35, 1 fingerprint from the anterior crest of the tibia. Stomach, everything. Gynecological, everything. Diseases of the channel, everything. Edema, everything the stomach channel does this. Yes. Now, why does this do everything? This is not in your books. I learned this from a Taoist guy. The depth that you needle stomach 36 has to do with what aspect of the channel will affect. If you want it to affect more the immune system, you do it superficial. If you go deep, then it can affect the bone. There's a treatise I read, a Shaolin treatise, so martial arts medicine, and it's being used for acute back pain. And they needle deep on stomach 36 and do lots of stimulation. I thought, that's weird. Is that because doesn't that make more sense for deficiency? But no, stomach 36 is just a very, very versatile point. And another reason, the explanation I was given by this Taoist gentleman by the name of Shun, was because the stomach is the earth is at the center of the 4 directions, of the 4 elements, 4 phases, 4 shapes, and so it has influence on all of the others. And stomach 36, being the He Si point and lower He Si point, is just very, very, it's like the center of the center, and that's why we use a lot. Needle perpendicularly, 0.5 to 1.5 cun. Moxa warmly welcome. Stomach 37, Xiangju Shu, lower He Si point of the large intestine. Large intestine is good for lower teeth, stomach for upper teeth. So this one is used for tooth pain as well. Diarrhea, dysentery, etc. Stomach 38, Tiao Kou. On the anterior side of the leg, 8 cun below stomach 35, 1 finger breadth from the anterior crest of the tibia. shoulder pain. This seems so weird, but it's used for shoulder pain. 0.5 to 0.9 Tsun. Moxa is applicable. Now, I've looked a long time, like, why the hell is this good for shoulder pain? Does it even make any sense? Lymphatically, it does. If you look at the way that the lymph can influence frozen shoulder, once you get that flowing, it can start to free up the shoulder, and then it has that effect. So in this way, stomach 38 has that effect. The frozen shoulder through the lymph is classically looked at as phlegm, and phlegm will often get lodged, especially in the right shoulder, as the yang Ming is not descending, so not descending. So this point is used in this way. Stomach 39. 下巨虚. Lower Husi point of the small intestine. On the anterior lateral side of the leg, 9 Tsun below stomach 35, 1 finger breadth from the anterior crest of the tibia. Stomach stuff. Salivation problems, sore throat, lumbar spine pain radiating to the testicle. Needle perpendicularly 0.5 to 0.9 Tsun. Stomach 40. Feng Long, the lower connecting points. This connects the spleen and stomach together. This is amazing for phlegm. All things phlegm. This is one of my favorite points for anybody who's overweight, which is most of American patients when they see you. I use this for back pain. People will say, well, it's not indicated for back pain. Well, if the problem is phlegm and phlegm is blocking the channels, you get that out of the way, everything else clears up. Miraculous. That's why kind of these point indications are a little bit bullshit. Understand where the channel is going, where the point is on the body, excess and deficiency, and the relationship between zangfu and channels, and you're good to go. Needle perpendicularly on Feng Long, 0.5 to 1.2 Tsun. Points of the foot, stomach 41 to 45. Stomach 41. Jie Xi. This is the Jing River point, in the central depression of the ankle, between the tendons of the long extensor muscle of the great toe and the long extensor muscle of the toes. Head and face problems, mental diseases, epilepsy, diseases of the channel. All things related to stomach stuff. But it generally takes fire away, so yeah, red face. Chongyang, the yuan source point. This has a little chong in it, and you can feel a pulse there. Nifty. On the instep between the tendons of the long extensor muscle of the great toe and the long extensor muscle of the toes, where the pulsation of the dorsal artery of the foot is palpable. Susceptibility to fright, disease along the channel pathway, toothache, all things that the stomach does. You want the stomach channel to do better because it's deficient. Chongyang is good because it's the yuan source point. Avoid the artery, needle perpendicularly 0.2 to 0.3 Tsun. Xiangu, the shoestring point, on the instep in the depression distal to the commissure of the second and third metatarsal bones. Stomach stuff, but in particular edema and swelling of the eyes and face. Stomach 44, 内庭, the Ying spring point, on the instep at the junction of the red and white skin proximal to the margin of the web between the second and third toe. This is good for removing heat, removing fire. Good for febrile diseases. Good for removing excess in the stomach channel, excess heat in particular. Used with Li4 for swelling gums and bleeding gums. Perpendicular or oblique, 0.3 to 0.5 Tsun. Stomach 45, 立对, the Jingwell point, on the lateral side of the distal segment of the second toe, point 1 cun posterior to the corner of the nail. Everything that the channel does if you wanted to do it a little bit less. And coma. Point 2 to point 3 chin. Moxa if you want. The spleen channel of the foot, Taiyin. What does the Ling Shu say? The spleen channel of the foot, Taiyin, originates at the great toe. It runs along the medial aspect of the toe at the junction of the red and white skin and ascends anterior to the medial malleolus and upward to the medial aspect of the leg. It keeps going up along the medial or posterior aspect of the tibia, crosses and goes in the front of the liver channel, passes through the anterior medial aspect of the knee and thigh, enters the abdomen, then the stomach, and connects with then the spleen, then connects with the stomach. From there it goes on, passing through the diaphragm and running alongside the esophagus, running over the lower surface of the root of the tongue. Branch from the stomach goes through the diaphragm and flows into the heart. So we're looking at the spleen, stomach, heart, and diaphragm. It ends up at the tongue, it goes through the esophagus and pharynx. In the Ling Shu it says, the diseases that stem from the spleen channel are stiffness of the root of the tongue. Why? Hey, remember it goes right up there. Ping! And as a result, if it's not nourishing due to blockage in the channel or deficiency, then that will cause stiffness in the tongue. Vomiting after eating, stomach ache, abdominal distension, frequent belching, relief of abdominal stension after opening the bowels or breaking wind. Again, that's a clear sign of excess. Or when the body retains a feeling of heaviness, aka dampness. The diseases of the spleen channel foot Taiyin relate to the spleen and manifest as pain at the root of the tongue, sensation of heaviness in the body with difficulty moving, poor appetite, restlessness, acute pain below the heart. Why? It goes to the heart channel. It nourishes the heart through this pathway. So if that's blocked, then the heart is not going to be happy. Difficulty in standing. Now in this case, yes, it's that the legs are weak, but also when people stand up, they can get dizzy. Swelling along the inner side of the thigh and knee, and inability to move the great toe. Channel points of the foot. Spleen points of the foot, 1 through 5. Yin Bai, on the medial side of the distal segment of the great toe, point 1 cun posterior to the corner of the nail. Bleeding problems, menorrhagia, in particular, spleen and stomach diseases of excess nature, mental diseases, lung and chest diseases, and toe pain. Oblique needling, point 1 cun, or prick to bleed. Da Tu, spleen 2, the yin spring point, on the medial aspect of the foot, in the depression at the margin of the red and white skin. Vomiting, diarrhea, constipation, febrile diseases with absence of sweating, swelling of the limbs, cold hands and feet. Point 3 to point 5, moxibustion is warmly welcomed. Tai Bai, the Yuan source point, the Shu stream point. On the medial border of the foot, in the depression at the junction of the red and white skin, posterior and inferior to the first metatarso-phalangeal joint. Spleen stuff, stomach stuff, gynecological stuff, channel pathway stuff, and coughing. And Wei syndrome, sensation of wasting, heaviness in the body. Perpendicular 0.3 to 0.5 cun. Gong sun, the lower connecting point, the confluent point of the chongmai, the penetrating vessel. On the medial border of the foot, anterior and inferior to the proximal end of the first metatarsal bone. Spleen stuff, gynecological stuff, chong stuff, foot stuff, dizzy stuff. Why dizzy stuff? Because blood stuff. Needle perpendicularly, 0.5 to 0.8 cun. Spleen 5, Xiangqiu, the Jing River point, in the depression anterior and inferior to the medial malleolus at the midpoint of the line connecting the tuberosity of the navicular bone and the tip of the medial malleolus. Gut stuff, brain stuff, channel stuff, sluggishness and somnolence. Needle perpendicularly 0.3 to 0.5 cun. Points of the leg, spleen 6 to spleen 9. Spleen 6, San Yin Jiao, our old friend, San Yin Jiao. Medial side of the leg, 3 cun, above the tip of the medial malleolus, posterior to the medial border of the tibia. Good for liver, kidney, all things gynecological, and mental diseases due to blood stuff, deficiency in particular, diseases of the channel. Very versatile point. Stomach 7, Lou Gu, on the medial side of the leg, on the line connecting the tip of the medial malleolus and spleen 9, 6 cun up from the tip of the medial malleolus, posterior to the medial border of the tibia. Abdominal distension, borborygmus, coldness and motor impairment of the leg and knee. It's kind of a loser point, to be real. Anyway, stomach 8, Di Ji. This is the spleen cleft point. Really important point for gynecological stuff, in particular dysmenorrhea and leukorrhea. Channel pain in the knee as well, and liver and kidney problems that originate with the spleen. So spleen is empty, then it causes liver and kidney points. This one's fairly good. Spleen 9, Yinling Quan, the Hesi point. Oh my Jesus. This is an amazing point for dampness. I love it so much. On the medial side of the line, the depression posterior to the inferior to the medial condyle of the tibia. Gut stuff, liver and kidney stuff due to water where it shouldn't be, causing gynecological problems, skin problems because water's where it shouldn't be, copious phlegm and other problems because water's where it shouldn't be. This makes you pee. 0.5 to 0.8 cun, moxa is warmly welcome. Points of the thigh. Oh, spleen 10. I have treated so many points, or so many patients just with spleen 10. They have blood stasis from some kind of accident. It's not moving well. Everyone's focusing on the area of injury. That's loser stuff. Focus on spleen 10 and get the blood moving. Then the body heals. Then every beat of their heart heals them, as opposed to you working with dry leather on their shoulder or knee, and it's just useless. Done well, this is one of the best points available. Shehai. When the knee is flexed on the medial side of the thigh, 2 cun above the superior medial corner of the patella at the prominence of the medial head of the quadriceps. Gynecological problems, skin diseases, disease along the channel. So here's what's up with spleen 10. All chronic diseases will end in 2 types of excess: blood stasis and phlegm. That's the end of the road. This takes care of dampness and blood stasis. Not exactly strong enough for phlegm. You need stomach 40 for that. But because you're dealing with chronic diseases, this is just one of the best points because it's addressing both blood and water. So we look at qi, blood, and body fluids. That's not three things. That's qi / blood and body fluids. And when you understand water and water is functioning the way it should be, then blood can, one, be produced properly, and two, get to where it needs to be. And qi is pushing. So in understanding the qi, blood, and body fluids, once you work out the body fluid component, then blood can be working. And this is why spleen 10 is functional for moving blood in this way. It's not just that it magically increases blood circulation by increasing, you would think a heart point would do that, right? And it does. Heart points do have that effect, but that's why spleen 10 is so good for blood circulation. And especially chronic conditions where blood isn't circulating, because that's where phlegm and dampness start to block the situation. Jiman, spleen 11. On the medial side of the thigh, on a line connecting spleen 10 and 12, 6 chun above spleen 10. Dysuria, pain in the genitals. Just give that a little scratch and you'll see what happens to a man's balls. They go, ah. Yeah, so that's why it has effects on the testicles as well. Stomach 12. Chongman. On the lateral side of the inguinal groove, 3.5 chun lateral to the midpoint of the upper border of the symphysis pubis, lateral to the pulsating external iliac artery. Abdominal pain, hernia, dysuria. Perpendicular insertion, 0.5 to 0.7 chun. Spleen 13. Fu shi. On the lower abdomen, 4 chun below the center of the umbilicus, 0.7 chun above spleen 12, and 4 chun lateral to the anterior midline. Hernia. Lower abdominal pain. Spleen 14. Fu jie. On the lower abdomen, 1.3 chun below spleen 15, and 4 chun lateral to the anterior midline. Abdominal pain along the umbilicus, abdominal distension, hernia, diarrhea, constipation. Perpendicular insertion, 0.8 to 1.2 chun. Spleen 15. Da heng. On the abdomen, 4 chun lateral to the center of the umbilicus. Good for gut stuff. Weakness of the limbs and palpitations. Perpendicular insertion, 0.8 to 1.2 chun. Spleen 16. Fu ai. On the upper abdomen, 3 chun lateral to the center of the umbilicus, 4 chun lateral to the anterior midline. Abdominal pain, indigestion, constipation, dysentery. 0.5 to 0.8 chun. Chest points. Spleen 17 to 21. 17. Shi dou. On the lateral side of the chest, in the 5th intercostal space, 6 chun lateral to the midline line. Spleen 17, 5th intercostal space, 6 chun lateral to the midline. Spleen 17, 5th intercostal space, 6 chun lateral to the midline. Spleen 18. Fourth intercostal space, 6 chun lateral. They both treat hypochondriac pain. And cough, spleen 18 is where you start to treat mastitis and insufficient lactation. 0.5 to 0.8 chun. Spleen 19. Xiong xiang. On the lateral side of the chest, 3rd intercostal space, 6 chun lateral. Hypochondriac pain, 0.5 to 0.8 chun. Spleen 20. Zhou rong. 2nd intercostal space, 6 chun lateral. Fullness of the chest, cough, hypochondriac pain, 0.5 to 0.8 cun. Spleen 21, 大包, the major lower connecting point of the spleen, on the mid-axillary line in the 6th intercostal space. Chest and lung diseases, helps to open up the lungs. Also, if you punch somebody here, you can shut down that lower connecting effect between the spleen and heart, and it causes a constriction around the heart. Very, very painful. It feels like an icy pain. So don't hit people here for fun, unless they take your seat on public transit, in which case you have my blessing. This concludes the Spleen Channel.